Nestled between Nigeria and Chad in the northern tip of West African country of Cameroon is the little town of Koza. This arid sub-Sahara region has volcanic mountains and savanna plains. People survive by herding cattle, sheep, goats, or farming peanuts, sorghum, millet, soybeans, cotton, and here you see the blue-green onion fields. Near the cell phone tower you will recognize the hospital compound by its hallmark boomerang-shaped main building. If you come by plane, we'll chase the sheep off the runway and send a crew out to make sure it is safe to land. There will be a welcoming party to greet you, and Mr. Kemji will pick you up in the hospital limo. Terraces ringing the Mandara Mountains can be seen from the rock and gully road to Koza that defines the phrase primitive road, as well as picturesque grass-roofed stone houses of the Mafa, or mountain people. As part of the Great Commission to take the good news of salvation to every tribe and nation, a group of pioneering Seventh-day Adventist missionaries from the U.S., Switzerland, and France started Koza Adventist Mission in 1957. Dr. Bergman, now in his 90s, and brother-in-law Dr. Brenwald were the first two physicians at Koza Adventist Hospital. Standing inside the courtyard, we see the boomerang-shaped hospital built with stone quarried from the nearby mountains. They moved from treating patients under the mango tree into this building in 1959. To the left are doctors' offices and a committee room. To the right is the ER and pharmacy. Covered walkways make it comfortable to walk between buildings in both dry and rainy season. The green building is central supply and administration. The next building is a business office, a large classroom, and the laboratory. Next comes pediatrics. Not visible from here and in the far end of the swept and tidy gardens is surgery, OB, and radiology. And once again we're back to the boomerang building. Before we go further, I would like to introduce you to Dr. Solomon, a young doctor from the Congo who has been the only physician at the hospital for most of the last 2 years and is very much looking forward to some help. Yves Kemji, the hospital administrator, who is a very capable, forward-thinking Cameroonian and determined to keep Christ first in all things. Mr. Kemji and Dr. Solomon take us on a tour of the offices and inside the building. The first office we see is the medical director, or Scott's office. It is an all-in-one room with a desk, medical records, 2-drawer file cabinet, sink, the supply cart, and the exam table. Next we'll go into the committee room. Besides having a nice place to meet and small library, this is where C.D. John, the short man to the right of Scott, gathers staff for special prayer every morning. C.D. John spent most of his working life as a nurse at Koza. Feeling the burden for people's souls as well as bodies, he is now the chaplain and makes Bibles and other spiritual books available to patients at a minimal cost. This morning in urgence, a sick girl is being brought in. A nurse will see her, order tests, prescribe meds, and make the decisions to treat, discharge, or admit, and if necessary, see the doctor. Urgence has 4 beds divided by curtains for privacy and is like our ER urgent care, minus working technical equipment, diagnostics, meds, and staff. God blesses and they still give good care. Dr. Solomon shows Scott central supply, which is clean and well organized. The laboratory is also spacious and clean, and as far as rural African hospitals, is fairly well equipped through an organization called Worldwide Labs, although it is limited in the number and type of tests they can do. Behind the lab is the new green chapel where staff, patients, family, and visitors gather for morning worships. It is flanked by the adult medicine and pediatric wards. These sturdy, beautiful old stone buildings are kept clean and tidy. I wonder what stories these stones could tell of angels and demons, diseases and plagues, joy and grief, prayers and miracles. I know angels still visit these rooms and touch the sick who come here. Occasionally, sparks come out of the walls from the 50-year-old wiring. It will soon be replaced with new wiring, and the angels won't have to work quite so hard. At the hospital entrance, clearly marked signs direct you to surgery, maternity, and radiology. It is found at the end of this tree-lined path. The cheerful radiology technician is happy to show you how the X-ray machine works and where he develops the films, the old-fashioned way. Note to self, need to find a new lead apron. Labor and Delivery has 2 delivery tables and a movable privacy screen, which gives new meaning to the term multiple births. A ceiling fan, tiled floor, a rarity in older buildings, steps to get on the table, a baby scale, equipment cupboard, and a nice long tiled work counter with 2 sinks and no faucets. This manually operated dental chair may not look pretty, but it still works. Some new upholstery and a dentist or tooth puller, and we're in business. Any volunteers? And now we come to Scott's favorite section, the OR. There are 2 surgical suites, each with double wash sinks, divided by the instrument sterilization room. Glass block helps provide natural lighting. Some of the equipment works, and some is junk for Jesus. There is a handy-dandy pass-through to the sterilization room. Everything to the left of the sink is dirty, and everything to the right is sterile. One of the 2 autoclaves used for sterilizing equipment works. I wish we could find a rubber gasket so they both could work. In the far back of the hospital complex are several 3-room buildings that provide short-term housing for students doing rotations from Koza University or other schools. There are showers and toilets nearby, but the cooking shelters in one of the buildings is in need of a lot of repair. Here are some random pictures from the hospital. Patient families hang colorful laundry up to dry. Here is our water tower, the hospital cafeteria, an employee social, and this is Wasili Paul, who has a lot of history of this hospital. He remembers helping Dr. Bergman plant and water these neem trees that now create a beautiful canopied avenue between the hospital and the church. The old Adventist church. Dr. Solomon's house, where Dr. Bergman was the first resident. The administrator, Mr. Kemji's house. The guest house. And our house, where you are always welcome. Sit on the veranda and enjoy the shade. Come have a meal with us. Enjoy some fruit from our mango, papaya, or guava or banana trees. And wherever God calls you to serve in the world, remember to bloom where you're planted. God bless.